Gestational weight gain is the next thing that we'll be discussing, and gestational weight gain is more of like somebody's gaining weight when the person became pregnant. You understand? So gestational weight gain, all right, your weight actually increased. Now, what actually contributed to your weight increasing was because of pregnancy. So it refers to the amount of weight a woman gains during pregnancy. It plays a crucial role in what both the health of the mother and also the health of the baby. Do you understand? So there are some one or two weight gains that could now be getting too much. Do you understand? Could now bring some one or two complications to the mother, bring some one or two complications to the baby. You understand? So what we have is we're trying to look at the normal weight, okay, a woman should have during pregnancy. All right, and the one that will consider that, okay, there's an issue coming in. All right, so pre-pregnancy BMI category, okay, then recommended weight gain, that's for single pregnancy. Do you understand? So if the person's weight was less than what the person's BMI as body mass index, right, if it was less than 18.5, the person was underweight before pregnancy, then normally the patient should gain about 28 to 40 lbs. Okay, that's about 13 to 18 kg when they become pregnant. That's normal. So I teach you guys in normal. This is because if they took your weight at the hospital, or you took the weight of a pregnant woman, I see anything that is what above this, that the person actually would gain too much weight. Okay, so if the person's weight was around 18.5 to 24.9, the weight was normal, then the person should normally gain about 11 to 16 kg after the pregnancy. If the person's weight before pregnancy was about 25 to about 29.9, the person was overweight during pregnancy. Before pregnancy, right? So during pregnancy, the person should just gain only little weight. Do you understand? The more weight you had before pregnancy, the little weight you should gain with pregnancy. I don't know if you understand how the thing is calculated. Then if the person's weight was about BMI, okay, about 30, more than 30, the person was obese before pregnancy, and the person should gain only 5 to 9 kg. Right? So for twin pregnancies, the recommendations are higher though. Alright? You can see the recommendations for what? Twin pregnancies. So this is what we can actually use to judge a pregnant woman to see if the weight she gained during pregnancy was too much. Do you understand? So why it matters is too little weight gain can be linked to you give birth to a baby and the baby's weight will be too small. I can even give birth to a baby before it is time for that baby to actually be due. Alright, then the baby can also have developmental issues. Now, if there's too much weight gain, there's risks for the woman having diabetes in pregnancy, there's risks for hypertension, there's risks for the baby not being able to go through the birth canal, so they just have to go in for cesarean delivery or cesarean section. Alright, so how to manage weight gain is tracking regularly. The woman will always be measuring her weight. Even if she's not coming to the hospital, she can have a weighing scale, keep it at home, always track it, then report back to the healthcare provider, like online. You understand? So eat balanced meals, focus on whole grains, lean proteins, fruits, vegetables, low fat diaries. Here they're just trying to talk about the calorie needs for different trimesters of pregnancies. First trimester, just eat your normal food. There's no extra calories needed. That's energy though. Second trimester, about 340 per day. Third trimester, about 450 per day. Of course, they are talking about this. This is because the baby will now be needing more. You understand? So as you are doing this, as you are eating, always be doing at least 150 minutes of exercise per week. So you can just be splitting it 30 minutes per 5 days in a week. You understand? So this have to go side by side with exercise if you want to balance things up.